So now let's talk about some stomach pathology, some miscellaneous here. First one, gastroparesis. Gastro means what? Stomach. Paresis or gastroparesis. The stomach is paralyzed. Mainly seen in diabetic people, no movement, or it can be coming as an idiopathic. You know, there's a nerve going to the stomach, vagus nerve for parasympathetic. Any injury or something happened there. So there is no bowel movement, or the food will be trapped inside the stomach. No motility. For diagnosing, you can do an endoscopy. Then the main one is the gastric emptying study. It means the food should be going out in a limited, the specific time. We'll give like 4 hours or 2 hours, see how much percentage stomach is cleared. If they are not clearing, there is a paralysis happen to the stomach or bladder. I mean, the stomach is paralyzed, right? So before doing this test, make sure you don't give patient no opiates, because that will decrease what? Stomach movement. No anticholinergic, and reduce blood glucose. Because this all can cause you what? Gastropathy, I mean gastric paralysis. Morphine will cause intestinal obstruction, right? So the best treatment for diabetic patient, reduce blood glucose, automatically you will be okay. Second thing you can do is give prokinetics. The drugs like metoclopramide, or we give the drugs like erythromycin. We can give the patient drugs like erythromycin. Next one, and you can ask the patient to have a meal that is low fiber and like in 3 or 4 meals, like split the meals into 3 or 4 in low volume, like more frequency, low volume, and they are low fiber, so there is no trapping of food inside, right? Then next one, cyclic vomiting syndrome. Some people will be vomiting, they will have GIT, motion problem, because they are using cannabis or weed smoker, marijuana smoker. So they will be vomiting, cyclic vomiting. So if you rule out other thing, you can tell them stop smoking these weeds, stop smoking, and treatment again we can give the prokinetics. Here also, if you want to rule out, do endo or endopsy plus endoscopy we can do to rule out other things. So if there is a history of cannabis or marijuana, like abuser, they will be vomiting, right? Next one, very important, gastric adenocarcinoma. From the word only, cancer of the stomach. It is mainly seen in Japan. People using what? Nitrates food or fermented food products. The patient will have unintentional weight loss, epigastric pain, right? The stomach, pain in the stomach, and they will have a history of some food like this. We can classify histologically this into 2. One is called interstitial, other is called diffuse. Interstitial means they will affect the lesser curvature of stomach, and it looks bulky, glandular. Diffuse means it's a type of infiltrative leather bottle appearance, linitis plastica, and you will see some called signet ring cells on biopsy. Signet ring cells. The main thing is about the complications of gastric cancer. First one, Virchow's node. Where is it? In the right? Sorry, not in the right. Left supraclavicular node, you can see. Next one, Krukenberg tumor, Kurkure, or remember, Krukenberg tumor. That is metastasis to ovary. They will be going to what? Ovary, bilateral ovary. Next one, sister married whom? Sister married Joseph nodule. So sister married Joseph, my God, right? So it is that metastasis to periumbilicus. Last one, acanthosis nigricans. It is not only here with the diabetes, with vitamin B12 deficiency in the axilla area, you can see a black colored thing. So these are the most common complications seen with what? Stomach cancer. Now, how you diagnose this cancer? Diagnosis is done by particularly you do CT of pelvis or abdomen. We will do endoscopy plus biopsy. You can even do PET scan or PET-CT scan. PET-CT, positron emitron tomography CT scan. Right, or pan-CT, this all can be pan-CT for staging. So CT of abdomen is the initial scan, right? To confirm, you can do endo biopsy, you can even do PET scan or pan-CT scan, all these are. So according to need, you can answer the question. So cancer treatment is gastrectomy or chemo or radiotherapy. That also according to staging or severity of the disease. So that's all about what? Gastric adenocarcinoma. Thank you.